We're staying in California now, where, as we just heard, new outbreaks are leading to a steady increase of infections and deaths. But one community you're about to see is so far succeeding in keeping the virus at bay, offering potential lessons on what happens when you start taking action early. The story comes to us from Mei-Ying Wu and Allison Stamos, reporters at the University of California, Berkeley's Graduate School of Journalism. Here's their report.
The Chinese New Year celebration this past February in San Francisco was a time of excitement, but also a time of fear. The coronavirus was spreading rapidly across China, and the first case had just been detected in the United States, causing alarm.
We can have an outbreak in Chinatown because we have a lot of people going back to China for Chinese New Year. Come in for testing.
Jian Zheng is the CEO of Chinese Hospital, an acute care facility in the heart of San Francisco's Chinatown. The neighborhood was poised for disaster. 15,000 people living in approximately 22 blocks, making it one of the densest neighborhoods west of Manhattan. To make matters worse, most of its residents are elderly, living in cramped, single-room occupancy hotels called SROs.
Our room is very small in the SRO. It's about 70 square feet.
Yongfa Zhu is 81 years old and has lived in this SRO for more than a year.
We have little space in here besides the bed. We don't have our own kitchen. We don't have our own restroom.
But now I got 2 showers.
The virus can spread easily here. Shared spaces like these have led to some of the deadliest outbreaks in the country. At Chinese Hospital, they planned for the worst.
I was expecting that we would be inundated with cases, that we would be intubating left and right, that we would have very sick patients filling our ER. Basically, to be overrun. And luckily, that hasn't been the case.
Since January, only 2 Chinatown residents have been hospitalized here, and there have been fewer than 20 cases of COVID-19 in the neighborhood, accounting for one of the lowest rates in the entire city. Zheng says it was all about preparation.
Because the outbreak happened in China first, so they learned a lot of lessons. We don't have to go through that in order to learn what to do.
In January, Zheng's staff was already masking respiratory patients outside the hospital to avoid transmission. Her network in China has shipped pallets of PPE to Chinese Hospital in San Francisco. Now there is an overflow. And they are helping mobilize others.
No need to panic.
As early as February 1st, Zheng teamed up with community leaders and city officials to give some of the earliest education on hygiene and sanitation.
We can stop this virus.
Local Chinese media shared the preventative messages widely.
Our community realized the potential risk for an outbreak early on because a lot of us experienced the SARS outbreak. A lot of people died.
Si Wing Pao, manager of Far East Cafe, one of the largest restaurants in Chinatown, shared information with his coworkers and customers.
I hung up flyers in the restroom, kitchen, and outside the restaurant. I also told our staff everything I learned on how to prevent infection.
The restaurant is closed for business right now. They are instead using the kitchen to further keep the virus at bay.
We're making a few hundred meals a day for elderly residents in the SRO. This helps minimize the shared kitchen and the chance of being infected.
It has, in some ways, been the simple things that have kept the infection rate low. Hot meals, more hand sanitizer, and increased cleaning.
They clean the kitchen, bathrooms, and the floor twice a day in our building. We stay in our rooms as much as possible because we are scared.
Recently, Chinese Hospital gave free tests to residents in Zhu's building.
We don't have a vaccine yet. We don't have a cure. So meaning that outbreak still can happen anytime. So we cannot let our guard down. So we still need to stay vigilant.
I'm still afraid. There have been cases in other SROs in the city, so we have to be more careful. If anyone tests positive, we can quarantine that person. It's beneficial to the person because they can get treated and it can protect others too.
All 32 residents in Zhu's building who participated tested negative for the coronavirus. And testing continues. Getting ahead of any infection will be essential for the eventual reopening of the neighborhood. For the PBS NewsHour, I'm Allison Stamos in San Francisco.